And we have one more presentation now, and then we'll go to open dialogue and questions and answers. I'd like to introduce Nicholas Parkhill, who's for over 20 years, has over 20 years experience in public health. For the last 5 years, he's been the CEO of ACON, NSW's leading organization specializing in HIV and LGBTI health. Nicholas has also held senior management and policy roles for the NSW government with a focus on drug and alcohol use. Welcome, Nicholas.
Thank you, Chris and Suzette. I'd like to start today by acknowledging the traditional owners of the land that we're meeting on today, the Cullen people of the Eora Nation, and pay my respects to their elders past and present. I'd also like to take the opportunity to thank the organisers for inviting me to present at today's session, and indeed holding such an important session, as well as acknowledge the fantastic work of those presenters who have gone before me. As Chris said, my name is Nicholas Parkhill. I'm the CEO of ACON. ACON is New South Wales' leading health promotion organisation specialising in HIV, from prevention through to care and support, as well as lesbian, gay, bisexual, transgender and intersex health. ACON has its base in Sydney, however we have a regional presence across the state of New South Wales. To give our international guests a context for that, we're just to the north of Victoria here in Australia, and the size of New South Wales, we're larger than Pakistan, we're larger than the state of Texas, and 4 times bigger than the UK. Increasing access to testing and treatment is a vital component of ACON's work, and indeed one of the pillars, what we believe to be an effective HIV response. In Australia, there's a growing optimism about our approach to HIV, and this is extended to the setting of bold targets, initially through the New South Wales HIV strategy, but more recently through the 7th National HIV strategy released in the last 2 weeks by our federal government. These targets are driving changes and innovation across the HIV sector in Australia, but indeed in New South Wales. Until recently, New South Wales had experienced a decade of relative stability in HIV notifications. In the context of gay men and other men who have sex with men, who are the most affected population in New South Wales, this makes up between about 70 to 85% of cases annually. In recent years, there has been a jump in notifications, particularly amongst gay men, which mirrors trends seen in other Australian jurisdictions and also international jurisdictions. Of course, while increases are of course concerning, we believe that more men knowing their status is cause for optimism in our ability to end the epidemic. Knowing your HIV status by testing more is essential if we're going to reach our goal. The New South Wales HIV strategy, which I've referred to, A New Era, has the overall goal of the virtual elimination of HIV transmission in New South Wales by 2020. 8 targets have been set which are integral to achieving the overall goal, one of which is the reduction of transmission of HIV for gay men and other homosexually active men by 60% by 2015. Key strategies for achieving this target are substantially increasing access to testing and the earlier uptake of treatment. This means that the whole New South Wales HIV sector have been required to reorient service delivery to prioritise actions that support this strategy. For ACON, this has meant the creation of new service models and the development of new engagement frameworks for gay men. Within ACON, our HIV action plan firmly situates increased testing rates, the promotion of earlier treatment, and maintaining a safe sex culture as core business of the organisation. We're delivering on this plan through a variety of mechanisms, including new partnerships with existing clinical services, upskilling and redirecting our workforce, maintaining our close links with researchers and the evidence base, and leveraging off our deep connections with the many different community groups who we come from and who we represent. For For the purpose of this presentation, I would like to focus on how we've gone about creating those linkages between public health and community sector workforces, particularly in the delivery of a community-based testing service, which has only been introduced in New South Wales within the last 12 months, despite onward of 5 years of advocacy from the community sector for the delivery of such services. Rapid HIV delivered in a community-based settings, as I mentioned, has just recently been introduced to Australia, and this is despite its long establishment in other jurisdictions. There has been many advocacy stumbles along the way, if you like, and I think for the onward activity to support our action plan and the New South Wales strategy, there's a number of key policy issues that need to be addressed urgently by the federal government, including the access to home-based testing and those other initiatives. Identifying undiagnosed HIV infection in gay men is essential if we're going to reduce new infections. While the majority of New South Wales testing occurs in New South Wales in GP settings or at publicly funded sexual health clinics, we knew from our experience of existing community-based testing sites in other jurisdictions that testing in community settings in New South Wales would absolutely prove an additional and complementary service to these existing services and the more traditional clinical-based services. With the impetus of the New South Wales strategy, we were given the green light to go beyond business as usual. Certainly with the support of the New South Wales Government and our HIV sector partners, we've been reorienting aspects of our service delivery. We've been working with clinicians to develop a new model. We call it A-Test, and for the first time it provides options for gay men who can now test within the community rather than within a clinical setting. Through this approach, we've sought to back bold policy leadership with community-based action and commence the process of refocusing the organisation. The changing context of the epidemic in New South Wales really required a long-term analysis of our existing health promotion projects and their ongoing utility. That meant hard decisions. Some programs had to be changed or reduced in order to accommodate this new focus on community-based testing services. A-Test is now operational across a number of sites in New South Wales and soon to be introduced across, in Sydney I should say, and soon to be introduced across New South Wales. The introduction of rapid HIV testing has fundamentally changed the testing experience for gay men, which we believe is producing results. The community response to accessing new technologies and new services is telling. Our evaluation consistently demonstrates that we're seeing a group of gay men who are non-regular testers or who are not linked in traditional testing services. We also know that gay men are very satisfied with the services. Our satisfaction rates are between 95% and 100%, and the two main reasons that they give for that satisfaction level is that it is in and of the community and the use of peers in the delivery of those testing and screening services. Importantly, it's attracting a new audience. 1/3 of those accessing our testing services have never had a previous HIV test. We've put a heavy emphasis on the training of our peer workers and our volunteers, and that is gay men. They are providing the tests to other gay men in non-clinical settings. The guys handle the informed consent. They do discussion of risk factors, they perform the tests and they give the result, all with clinical oversight being provided by our funded sexual health partner organisations. In addition to the initial training of our peer workers and volunteers who undertook to perform this role, they are engaged in a program of continual quality assurance to ensure they are highly competent and the quality of peer-driven services are as high as we would expect elsewhere. In enhancing our workforce to meet this new service challenge, we have developed linkages that leverage the skills and technical expertise of the Australian Society in HIV Medicine, the Kirby Institute, St Vincent's Hospital, and our service delivery partners, Sydney Sexual Health Centre and Royal Prince Alfred Sexual Health. In addition to these partners, the ACON test partnership model involves a number of other partnerships, most notably with local health districts in New South Wales, the Australasian Federation of AIDS organisations, and importantly, the New South Wales Ministry of Health. Given we've moved into this type of service provision for the first time, we recognise the requirement to enter into formal agreements with these clinical partners. These memorandum of understanding provide the required level of formality in terms of clinical governance, but they also provide a clarity around roles and responsibilities and to ensure, and critically importantly, to ensure that we share data and key learnings from each of our services that we're running together. While I think we would have said we were partners before the new HIV strategy, I think we're now in an era where these partnerships and development represent stronger linkages between the community, the clinical and the research workforces. Initial results, well, of course, reorienting a large organisation in response to new targets can be disruptive and it can also be challenging. However, the rewards can also be clearly demonstrated. In the case of the experience of ATEST, we've shown that new options and the use of new technologies by community can be effective in attracting first-time users, testers, I should say, and those that have not tested regularly. These principles can also be applied to other testing technologies and improvement in prevention technologies and earlier treatment access. Earlier this year, there was a jump of 5% in the number of men reporting having been tested and a decline in those saying that they had never been tested before has actually stopped. While we're always weary of putting too much emphasis on data as it moves from one year to the next, we believe that this indicates we're heading in the right direction. Of course, community mobilisation is key to achieving the changes in safe behaviour, testing and treatment that is really required to end HIV transmission. This requires the ongoing support of organisations that are really part of the communities that they serve. Understanding the barriers that some men face, such as privacy, stigma, cost, and developing ways to overcome them requires a deep understanding of the sexual cultures of gay men, a willingness to engage in that culture in an open, direct and positive way, which can often be difficult for governments to do. The title of this symposium really asks us an important question: in whose interest, under whose control? And these are very critical questions. 30 years ago, the gay community in New South Wales, and indeed Australia, showed the way. We acted together in our own interests, but also in the interests of public health. We were placed unwittingly in the centre of a broader public health response to a devastating virus. While, of course, many things have changed since the 80s, one thing has not. Gay men, who are the main priority population group for the HIV response in New South Wales, remained the key to ending HIV in New South Wales. Unless our policy frameworks and our service structures are built in our interests and increasingly are in community control, we will struggle to see the kind of community mobilisation we need to meet such ambitious public health targets. In this effort to deliver services and structures that meet gay men's needs, I want to acknowledge the sister organisations ACON works alongside, the Victorian AIDS Council, the Western Australian AIDS Council and the Queensland AIDS Council, and the Australian Federation of AIDS Organisations. The gay community in New South Wales is demonstrating that they are listening to this message and are willing to act in order to end the epidemic. We've seen unprecedented testing rates in New South Wales. We've seen earlier diagnoses which are all early signs of success on the long road to ending HIV. The popularity of rapid HIV testing in community settings demonstrates the appetite for easier access to testing and also testing outside of clinical settings. To make testing as easy as possible, we need a broad mix of testing options available for gay men, including the fast and early adoption of new technologies as they come online. Advocacy from the community sector, the interest that we represent, has always been about reciprocation of responsibility. Leadership from government can only translate into results via community action. The New South Wales is setting benchmarks in Australia in terms of creation of new policy frameworks, and while we thank the federal government for their recent steps forward, we're not where we need to be, and thus the job remains far from being done. While I acknowledge the regulatory agencies act to safeguard the communities from perils from early adoption of some technologies, a horribly slow and overly paternalistic approach means that we are not backing our words with some actions. Gay and other homosexually active men are willing to act in the interest of public health and increasingly want to be in control of their health, including timely access to these new technologies. In the celebrated HIV partnership, ACOM believes this call is reasonable and proportionate, considering the actions we are asking to gay men to take. Thank you for the opportunity once again to present, and I'd just like to acknowledge those people who have prepared this presentation, but also really deliver on this in fantastic work. Thank you.
Thank you, Nicholas. I think it was interesting in the last two presentations to see demonstrations of how, community involvement and engagement in the development and rollout of programs really does produce, better results. And it was equally interesting to see it in the context of a developing country and a developed country, and also particularly, with key affected populations and with women. So I want to thank the last two presenters for giving us that perspective in terms of this discussion.